Hello students, subscribe the Fundamental Pharmacy and press the bell icon for more videos.
Hello students, join our online course for GPAT Niper Drug Inspector to get assured amazing rank.
Hello my dear students, welcome back to the Fundamental Pharmacy. Today we are going to see another classification number 36, Anti-Cancer Drugs Part 3. We have already seen Anti-Cancer Drugs Part 1, Part 2. This classification is really important for your upcoming GPAT Niper Drug Inspector and Government Pharmacist exam. I would like to request you, please watch this video until end. My dear students, we have already seen 35 classification videos. If anybody has not seen previous classification videos, please go in the channel's playlist and watch all the classification videos, because they are really important for your GPAT Niper DI Pharmacist exam. And believe me, a lot of MCQs they are going to be covered just by watching these videos. In fact, from my last two videos on anti-cancer drugs, there was a 2 question in GPAT 2023. So again, they are really important. One question was from monoclonal antibodies and one question was from adverse effect of cyclophosphamide. That is nothing but the hemorrhagic cystitis, and that is treated with the one drug known as mesna. That is nothing but the mercaptoethane sodium salt of sulfuric acid. That was a question in GPAT 2023. So this classification is very important. Again, I would like to request you, please go and watch all the classification videos from the channel's playlist. My dear students, today we are going to see classification number 3, anti-cancer drugs. This classification. So anti-cancer drugs, they are classified into again different types. We have already seen cytotoxic drug class 1, cytotoxic drug class 2, anti-cancer antibiotics, then plant products. So next is nothing but the targeted anti-cancer drugs. Targeted anti-cancer drugs. So these targeted anti-cancer drugs, they are targeted. Targeted means they are specifically targeted for a particular type of cancer, right? So they are useful in the particular type of cancer. So targeted drugs means what? So in case of particular cancer, so there is a overexpression of tyrosine kinase activity, or overexpression of some particular genes, or overexpression of particular growth factors. So targeted drugs. In that you have tyrosine protein kinase inhibitor. Tyrosine protein kinase inhibitor. So tyrosine protein kinase inhibitor मतलब क्या है? ये एंजाइम को इनहिबिट करने वाले ड्रग्स. So further inhibition of tyrosine kinase or increased activity of tyrosine kinase is observed in particular type of certain cancer, myeloid leukemia, etc. So tyrosine protein kinase inhibitors, imatinib and nilotinib. Remember the drugs imatinib and nilotinib. Then second class is there, epidermal growth factor receptor inhibitor. Epidermal growth factor receptor inhibitor. In that you have gefitinib, erlotinib and cetuximab. Gefitinib, erlotinib, cetuximab. Now third class in the targeted drugs is nothing but the angiogenesis inhibitor. So angiogenesis मतलब क्या है? जो ब्लड वेसल होता है उसका प्रोलिफरेशन, उसका मल्टीप्लिकेशन, इसको बोलते हैं वैस्कुलर epidermal growth factor inhibitors. So angiogenesis inhibitors or vascular epidermal growth factor inhibitors. So in that you have two drugs known as sunitinib and bevacizumab. Sunitinib and bevacizumab. Then proteasome inhibitors. In that you have bortezomib and monoclonal antibody. In that you have rituximab. So in that you have a lot of monoclonal antibodies. So rituximab is a monoclonal antibody particularly against CD20 cells. So CD20 सेल जो होता है उसके ऊपर जो पर्टिकुलर एंटीजन होता है उसके साथ में कंबाइन करते हैं. So particular antigen is expressed in a particular type of cancer. कुछ कैंसर ऐसे होते हैं कि जिसमें जो CD20 सेल्स होते हैं उसके ऊपर एक पर्टिकुलर एंटीजन होता है. ये एंटीबॉडीज उसको बाइंड करके वो सेल को इनहिबिट करते हैं, सेल लाइसिस होता है. So monoclonal antibody rituximab. Now hormonal drugs they are also useful in the particular type of cancer. So hormonal means every kind of hormones they will be used. Okay. So for example, first one is nothing but the glucocorticoids. glucocorticoids. So in that you have prednisolone and dexamethasone. So glucocorticoids में prednisolone and dexamethasone, they are the most commonly used drug. तो prednisolone का active metabolite होता है pregnenolone. Dexamethasone is also glucocorticoid. So why these drugs are used in the particular type of cancer? जो glucocorticoids होते हैं, these glucocorticoids they inhibit the lymphoma and certain kind of leukemia and lymphoma, certain kind of cancers. They are lympholytic in nature. They are a lympholytic in nature. That's why they are useful in the lymphoma. Okay. Now these drugs also are used in the combination with the other anti-cancer drugs. जो ग्लूकोकॉर्टिकॉइड्स होते हैं वो बाकी एंटी कैंसर ड्रग के साथ में भी यूज किए जाते हैं. जैसे फॉर एग्जांपल केमोथेरेपी इंड्यूस्ड इरिथीमा. केमोथेरेपी की वजह से जो यहाँ पे इडिमा होता है, इरिथीमा होता है, टू कंट्रोल दैट ग्लूकोकॉर्टिकॉइड्स आर यूज्ड. ठीक है. टू कंट्रोल द वोमिटिंग आल्सो, टू कंट्रोल द एडवर्स इफेक्ट ऑफ एंटी कैंसर ड्रग्स. सो ग्लूकोकॉर्टिकॉइड्स दे आर यूज्ड. नाउ सेकंड क्लास इन द हार्मोनल ड्रग estrogen. Okay, estrogens. So they will increase the estrogen level in the body and they are useful in the breast cancer and prostate cancer. Okay, so prostate cancer में क्या होता है कि there is a increased activity of androgens. So estrogens will decrease the activity of androgen. Ethyl estradiol and phosphostrol. Ethyl estradiol and phosphostrol. These are the drugs. Now third category in the hormonal drug is nothing but the selective estrogen receptor modulators. Selective estrogen receptor modulators. So in that you have tamoxifen and toremipin. Tamoxifen and toremipin. Now इसके ऊपर क्वेश्चन आ चुका है selective estrogen receptor modulator. That is a tamoxifen and toremipin. Okay, tamoxifen, toremipin. Third class in the hormonal drug, that is nothing but the selective estrogen receptor down regulator. Selective estrogen receptor down regulator. तो डाउन रेगुलेटर मतलब क्या होता है? इट इज द एंटागोनिस्ट. सो यू कैन से सिलेक्टिव एस्ट्रोजन रिसेप्टर एंटागोनिस्ट, सिलेक्टिव एस्ट्रोजन रिसेप्टर डाउन रेगुलेटर. तो एग्जांपल क्या है? फुलवेस्ट्रांट. फुलवेस्ट्रांट इज अ सिलेक्टिव रिसेप्टर, सिलेक्टिव एस्ट्रोजन रिसेप्टर डाउन रेगुलेटर और एंटागोनिस्ट. फुलवेस्ट्रांट, रिमेंबर. नाउ नेक्स्ट क्लास हार्मोनल ड्रग इज नोन एज अ हार्मोनल एंटागोनिस्ट. हार्मोनल एंटागोनिस्ट, ये क्या है? हार्मोनल एंटागोनिस्ट. Exam class is nothing but the aromatase inhibitor. Aromatase inhibitor. Aromatase क्या है? Aromatase एक enzyme होता है. What is the role of that aromatase? So aromatase is involved in the conversion of your androstenedione to the estrone. So जो androstenedione होता है या फिर androgens होता है, they are converted into estrones by aromatase. Okay. So aromatase enzyme क्या करता है? एंड्रोस्टेनिडायन या फिर एंड्रोजन को एस्ट्रोन में कन्वर्ट करता है. एंड इनहिबिशन ऑफ दिस एरोमेटेज बाय सर्टेन ड्रग्स, दे आर यूजफुल इन द प्रोस्टेट कैंसर, दे आर यूजफुल इन द सर्टेन ब्रेस्ट कैंसर्स, राइट. सो इन दैट एरोमेटेज इनहिबिटर्स यू हैव डिफरेंट ड्रग लाइक लेट्रोजोल, anastrozole and exmesten. Letrozole, anastrozole and exmesten. So there was a question in GPAT 2023 about this aromatase inhibitor. तो ये जो लेट्रोजोल है, एनेस्ट्रोजोल है, एक्समेस्टेन है, ऑप्शन में ये तीन ऑप्शन थे और एक ऑप्शन था उसका आईपैक नेम पूछा था. आईपैक नेम था लेट्रोजोल का. ओके, aromatase inhibitor. सो इसके ऊपर GPAT 2023 में क्वेश्चन आ चुका. नाउ अनदर क्लास ऑफ हार्मोनल ड्रग्स नोन एज एंटी एंड्रोजेंस. सो एंटी एंड्रोजेंस इन दैट यू हैव फ्लूटामाइड एंड bicalutamide. Flutamide and bicalutamide. So these are the anti-androgens. Next class in the hormonal drugs, that is known as a 5-alpha reductase inhibitor. 5-alpha reductase inhibitor. So in that you have finasteride, dutasteride. So इसके ऊपर भी क्वेश्चन आ चुका है ऑलरेडी जीपैट में. 5-alpha reductase inhibitor, finasteride and dutasteride. Remember. Now growth hormone regulating. Okay. Now gonadotropic hormone regulating hormone analogs. Means gonadotropic hormone regulating hormone, its analogs. So remember ralins, neparalin. So all the ralin, neparalin, bicaralin, there are certain drugs known as the ralins. nefarelin, leuprorelin, okay, nefarelin, leuprorelin, triptorelin. These are the relins. So growth gonadotropin releasing hormone analog. Nefarelin, leuprorelin and triptorelin. So relins जो है they are gonadotropin hormone releasing hormone analog. So relin, nefarelin, leuprorelin and triptorelin. Relins are nothing but the gonadotropin releasing hormone analogs. Now next category of drugs or hormonal drugs known as progestins. So in that you have hydroxyprogesterone, acetate and other progesterone derivative. So these are the hormonal drugs. Okay, so I would like to revise you again in a very short. Anti-cancer drug part 3, targeted drugs. So in that you have tyrosine protein kinase inhibitor, imatinib, niclotinib. Second class in targeted drugs, epidermal growth factor receptor inhibitors, jeptitinib, irlotinib, and cetuximab. So these are the drugs. They are mostly used in the colorectal cancers. They are used in the small cell lung cancer. They are used in the renal cancers, right? Now, angiogenesis inhibitor, they are mostly used in the renal cancers. So, angiogenesis inhibitors, so sunitinib, bevacizumab. Angiogenesis inhibitors, they are also known as a VEGF receptor antagonist, vascular endothelial growth factor receptor antagonist. Now, another drug, proteasome inhibitors, known as a bortezomib. Monoclonal antibodies, they are a particular type of monoclonal antibodies against the antigen present on the cancer cell. Antigen present on the cancer cell. So monoclonal antibodies. So in that you have rituximab. It is a particular monoclonal antibody against CD20 cell. In the hormonal drugs, you have different classes like first one is glucocorticoids. So in that prednisolone and dexamethasone, they are most commonly used. So they are the lympholytic in nature. They are used in the adenoma and lymphoma. Okay. Then estrogens, ethyl estradiol, phosphosterol. They are the estrogens useful in the prostate cancer and breast cancer in the male. Then selective serotonin selective estrogen reuptake modulators, selective estrogen reuptake modulator, tamoxifen and toremipene. They are the drugs. Tamoxifen, toremipene. They are the selective estrogen receptor modulators. You have to remember. Another category in the hormonal drug known as a selective estrogen down regulator, or you can say selective estrogen receptor antagonist. So fulvestrant. Fulvestrant is nothing but the selective estrogen down regulator or selective estrogen receptor antagonist. Now aromatase inhibitor, they will prevent the conversion of androgen to estrone. So letrozole, anastrozole, exmestane. These are the anti-androgens. In that you have flutamide and bicalutamide. Flutamide and bicalutamide. Okay, these are the 5-alpha reductase inhibitor. In that you have finasteride and dutasteride. Okay, gonadotropin regulating hormone, gonadotropin releasing hormone analog, neparelin, leuprorelin and triptorelin. So gonadotropin regulating hormone or gonadotropin releasing hormone analog, neparelin, leuprorelin and triptorelin. Now progestins, they are used in the cancer, hydroxyprogesterone, acetate and other. So this classification you have to remember. Now we'll see it again. Hormonal and related drugs. Hormones and related drugs which are used as an anti-cancer drug. So corticosteroids like prednisolone and prednisone. Then dexamethasone is also. Anti-estrogens. Anti-estrogens, in that you have different categories like selective estrogen receptor modulators, tamoxifen, doloxifene. Then aromatase inhibitor, in that you have different drug, aminoglutamide, formastane, then exmestane, anastrozole, orozole and letrozole. Then progestins, in that you have methyl progesterone acetate. Estrogens, diethylstilbestrol, ethyl estradiol. Androgens, in that you have testosterone. Anti-androgens, you have flutamide, gonadotropin regulating hormone analogs. leuprolide, goserelin, nefarelin, busurelin, and esterelin. Growth, okay, gonadotropin releasing hormone antagonist. In that you have सीटोरेलिक्स, गैनीरेलिक्स, अपारेलिक्स. तो रेलिक्स वाले जो है वो एंटागोनिस्ट है एंड रेलिन वाले जो है वो एगोनिस्ट है. सो गोनाडोट्रोपिन रेगुलेटिंग हार्मोन एनालॉग्स, एनालॉग जो है रेलिन्स, देखो हिस्टेरेलिन, बुस ओके, बुसुरेलिन, नाफेरेलिन, गोसेरेलिन, ल्यूप्रोलाइड. These are the analogs of gonadotropin releasing hormone analog. Okay, and gonadotropin releasing hormone antagonist relics, cytorelics. Okay, then ganirelix, abarelix. Now again anti-cancer drug miscellaneous agent. ये जो miscellaneous agent होते हैं, they are the drug used to prevent the toxicity of anti-cancer drug. So in that you have biological response modifiers. So you recommended interleukin 2, that is aldesleukin, granulocyte, monocyte colony stimulating factor, sargramostin, granulocyte stimulating factor, colony stimulating factor known as a filgrastim, granulocyte colony stimulating factor, filgrastim, monoclonal antibodies against the, they are nothing but the rituximab, trastuzumab, substituted urea known as a hydroxyurea. It is nothing but the, it inhibits the synthesis of nucleotides. So nucleotide synthesis inhibitor hydroxyurea. Then adrenal cortex suppressant example is a mitotane, tyrosine kinase inhibitor. They are nothing but the imitinib, jeptitinib, irlotinib. Then retinoids like isotretinoin or tretinoin known as ARA. ARA means all trans retinoic acid. Arsenic compound like arsenic trioxide. Adenosine deaminase inhibitor, pentostatin. Adenosine deaminase inhibitor, pentostatin. Right. Now we'll see important points from this anti-cancer drug. So देखो drug inhibited tyrosine kinase activity. So tyrosine kinase activity inhibited. Tyrosine kinase activity is increased, that is inhibited by certain drug known as a targeted anti-cancer drug. So drug inhibit tyrosine kinase activated by. So there are, these are the factors which activate the tyrosine kinase activity in certain kind of cancers. Okay, so drug inhibit, drug in the first column drug, second column inhibit tyrosine kinase activity activated by, then uska use indication. So first is a apatinib. Apatinib is inhibit the tyrosine kinase activity increased or activated by these factors. So epidermal growth factor receptor, epidermal growth factor receptor, HER2 means human epidermal receptor 2. HER4 is also human epidermal receptor 4. So it is used in the non-small cell lung carcinoma, NSCLC, non-small lung cell carcinoma. Axitinib, again it is a inhibit the tyrosine kinase activated by VEGFR, means vascular endothelium growth factor receptor 1 to 3. So also it is used in the advanced cell renal carcinoma. Then bosutinib. So bosutinib, so it inhibits the tyrosine kinase which is activated by this ABL-BCR gene. So what is this? Philadelphia chromosome. This is known as a Philadelphia chromosome. So it is useful in the chronic myeloid leukemia. Chronic myeloid leukemia. Then again, seritinib. Seritinib also inhibit the tyrosine kinase activity increased by ALK. So it is also useful in the non-small cell lung carcinoma. Crizotinib. So it increases this c-MET and ALK. It increases the tyrosine kinase activity which is inhibited by this crizotinib. So again useful in the non-small cell lung carcinoma. Cabozantinib. So again cabozantinib is a antibody. It is a drug, targeted drug useful in the medullary carcinoma thyroid. Okay. So like dabrafenib useful in the metastatic melanoma. Dasatinib useful in the chronic myeloid leukemia. Erlotinib, so it is a targeted drug for tyrosine kinase which is activated by epidermal growth factor receptor, useful in the again non small cell lung cancer and prosthetic cancer. Jeptinib, Jeptinib, again same thing, useful in the small cell lung cancer. Ibrutinib, so it again it decreases, it inhibits the tyrosine kinase activity, which is increased by this gene BTK. So again useful in the chronic lymphoidal leukemia. Imatinib, so again it is against the Philadelphia chromosome, useful in the chronic myeloid leukemia and gastrointestinal stomal tumor. Lapatinib, so against the then human epidermal receptor 2 new, so useful in the breast cancer. Levatinib is nothing but the iodine 131 refractory differentiated thyroid cancer. Niclotinib, again it is against targeted against the this gene, inhibit the tyrosine kinase activity, used in the chronic myeloid leukemia. Pazopanib, against it is against the vascular endothelial growth factor receptor, means they are the vascular endothelial growth factor means anti-angiogenesis. They are useful in the advanced renal cell carcinoma. So we'll see next point. Again drug targeted and indications. Ponatinib, next is nothing but the ponatinib. So it is against the this ABL-BCR gene, which activate the tyrosine kinase, used in the chronic myeloid leukemia and acute lymphoidal leukemia, which is a positive Philadelphia gene. Okay. Now regorafenib, so again vascular dermal growth factor 2, useful in the colorectal carcinoma and gastrointestinal stomatal tumors. Then rauloxinib, against the JAK1 and 2, useful in the myelofibrosis. Sorafenib, useful in the renal cell carcinoma and hepatocellular carcinoma. Sunitinib, useful in the renal cell carcinoma, pancreatic neuroendocrine tumors and gastrointestinal stomatal tumors. Tofacitinib, against the JAK, which activate the tyrosine kinase, and it is inhibited by this drug tofacitinib, used in the rheumatoid arthritis. Tremetinib, useful in the metastatic myeloma. Vandetanib is useful in the medullary carcinoma of the thyroid. Bemurafenib, useful in the malignant myeloma. We'll see the next. Monoclonal antibodies targeted against indication and comments. This chart is again very important. इसके ऊपर क्वेश्चन आ चुका है GPAT 2023 में. So first one is the rituximab. Rituximab is a monoclonal antibody targeted against the CD20 cell known as the B cells. B cell होता है. So in that B cell, they in the some certain cancer they have antigen on the B cell. So rituximab is a drug against the CD20 cell, used in the non-Hodgkin lymphoma. Alemtuzumab is against CD52 cell, low-grade lymphomas and chronic lymphoidal leukemia, used in the okay. Then trastuzumab, it is a monoclonal antibody against HER2 in human epidermal receptor 2 new, useful in the breast carcinoma, and it can has an adverse effect of cardiotoxicity. Trastuzumab can cause cardiotoxicity. Cetuximab and panitumab, so they are against the epidermal growth factor receptor. They are epidermal growth factor receptor positive metastatic colorectal carcinoma. इसमें यूज किया जाएगा उसका. What is the adverse effects? Rash, hypermagnesemia, intestinal and lung disease. Then next आता है आपका bevacizumab. So again it is a targeted drug against the targeted monoclonal antibody against the vascular endothelial growth factor. So angiogenesis, responsible for the angiogenesis. So it is used in the metastatic colorectal carcinoma and it is used along with the 5-fluorouracil. Gemotuzumab and ozogamicin, so against the CD33 cells. So acute myeloid leukemia, CD33 positive acute myeloid leukemia, so used okay. Then it is linked with the calichyamicin, linked to calichyamicin. Iodine 131 linked tocilizumab. Okay, yttrium 90 linked yttrium 90 linked ibritumab. So against the CD20 cell used in the relapse lymphomas. These are the antibody conjugated with the radioisotopes. Denileukin used in the recurrent type of cutaneous T lymphocyte lymphoma. Denosumab. It is used in the giant tumors of bones. Also used in the osteoporosis. Obi Obinutuzumab. They are against the CD20 cells. Obinutuzumab. Obinutuzumab. So used in the chronic lymphoidal leukemia. Combination with the clorambucil. Used in the combination with clorambucil. We'll see next. Pertuzumab. Pertuzumab is a targeted antibody against the human epidermal receptor 2 used in the breast cancer. It also inhibits the dimerization of HER2 gene or the ipilimumab against the CTL4 cells. It is used in the malignant melanoma. Ramucirumab is a drug against the vascular vascular endothelial growth factor, so used in the gastroesophageal adenocarcinoma, act as a angiogenesis inhibitor. Monoclonal antibody targeted against an indication and its comment. Nivolumab against PD-1 cell used in the non-small cell lung cancer, metastatic melanoma, cancer of melanin, inhibit the interaction of PD-1 with ligand T cell. Then dinutuximab. So glycolipid CD2 cell के अगेंस्ट में एंटीबॉडी है. Children with the high risk of neuroblastoma. तो बच्चों में न्यूरोब्लास्टोमा जिसमें है उसमें यूज करेंगे. Used in the combination with the granulocyte monocyte cholinesterase factor. Then interleukin 2 retinoic acid. Next is Vilatetumomab against CD19 and CD3 cell. So Philadelphia negative B cell acute lymphoidal leukemia. Pembrolizumab monoclonal antibody against PD-1 metastatic melanoma. That is the use. Now selected toxicity of your hormonal drugs. So frutamide anti-androgenic drug है. So it can cause hot flushes, liver dysfunction. Selective estrogen receptor modulators in those drugs, they can cause menopausal dysfunction, fluid retention, thromboembolism, increase the incidence of endometrial cancer. तो प्रोजेस्टिन का एडवर्स इफेक्ट क्या रहेगा? फ्लूइड रिटेंशन. कॉर्टिकोस्टेरॉइड का फ्लूइड रिटेंशन, डायबिटीज, इंक्रीज द ससेप्टिबिलिटी फॉर इन्फेक्शन, मतलब इम्यूनिटी कम कर देगा, एंड हाइपरटेंशन. गोनेडोट्रोपिन regulate or releasing hormone agonist. It can cause transient flare-up reaction, hot flushes, impotence, gynecomastia, osteoporosis. Because growth gonadotropin releasing hormone agonist क्या करेंगे? ये they will increase the luteinizing hormone and follicular stimulating hormone in the males. So it can cause flare-up reaction, hot flushes, impotence, gynecomastia, and osteoporosis. So aminoglutamide. So it can cause adrenal insufficiency, myelosuppression, and rest. Aromatase inhibitors का क्या करेंगे? Fatigue, hot flushes, arthralgia. Drug of choice in some case of malignancy. Acute lymphoid leukemia में कौन से drug of choice है? First है vincristine. So first is vincristine, prednisolone, and maintenance drug is a marcapavirin, methotrexate or cyclophosphamide. Acute myeloid leukemia में cytosine, araminocyte, that is citabine and doxorubicin, ये drug of choice है. Chronic lymphatic leukemia में clorambucil and prednisolone. Chronic myeloid leukemia में busulfan, imatinib and indirabans. Hodgkin's disease में आपका MOP मतलब मैक्लोरिथामाइन, oncovarin मतलब vincristine, procarbazine and prednisolone, और vinblastine, doxorubicin, dicarbazine, bleomycin. Non-Hodgkin's lymphoma में cyclophosphamide, doxorubicin, vincristine, prednisolone. कार्सिनोमा ऑफ स्टमक में फ्लोरोसिल, सिस्प्लाटिन. कार्सिनोमा ऑफ कोलन और कोलन कैंसर में फ्लोरोसिल, इरिनोटिकैन. Multiple myeloma में melphalan and prednisolone they are the drug of choice. कोरिरियो कार्सिनोमा में ड्रग ऑफ चॉइस होता है methotrexate कोरिरियो कार्सिनोमा. कार्सिनोमा ऑफ टेस्टिस इटोपोसाइट्स ब्लियोमाइसिन सिस्प्लाटिन. ओस्टियोजेनिक कार्सिनोमा में methotrexate डाउनोरोपिसिन विनक्रेस्टिन. विलियंस ट्यूमर्स में ड्रग ऑफ चॉइस होता है विनक्रेस्टिन ट्रोमाइसिन डी. कार्सिनोमा ऑफ हेड एंड नेक फ्लोरिसिल सिस्प्लाटिन. कैंसर carcinoma of lung, cisplatin and paclitaxel. So these are the few drug of choice. Adjuvant drugs for the anti-cancer drug. So whatever anti-cancer drug you are using, they can have certain adverse effect. So drugs used along with the anti-cancer drug to prevent their adverse effect. तो anti-cancer drugs के adverse effect prevent करने के लिए drug उनके साथ में combine किया जाता है. ऐसे कौन से drug है? So first is allopurinol. It inhibits the xanthine oxidase and it prevent the hyperuricemia from tumor lysis syndrome. Rasburicase. Rasburicase is a recombinant urate oxidase. Rasburicase is a recombinant urate oxidase enzyme. It prevents the hyperuremia from the tumor lysis. जब ट्यूमर ब्रेकडाउन होता है तो हाइपरयूरिमिया होता है, तो उसमें ये ड्रग एलोपिरिनॉल रासब्यूरिकेज. ठीक है. मेस्ना और मेस्ना एक ड्रग होता है. मेस्ना मतलब मार्केप्टोइथेन सल्फोनेट सोडियम. मार्केप्टोइथेन sodium salt of sulfonate. So it is a neutralizing agent. It is used to prevent the hemorrhagic stenosis caused by cyclophosphamide or ifosfamide. Okay. Leucovorin is a drug which is used to prevent the folate toxicity. Okay. Or it is used to prevent the methotrexate toxicity. So replete tetrahydrofolic acid. Leucovorin मतलब क्या है? फोलिनिक एसिड होता है. So it is used to rescue the methotrexate toxicity. It is known as the leucovorin rescue. Amifostine is used to prevent the radiation-induced xerostomia, or also used in the prevention of kidney toxicity caused by cisplatin. So prevent the radiation-induced xerostomia and cisplatin-induced nephrotoxicity. Derazoxane. So it is an iron chelator, prevent the cardiotoxicity caused by anthracyclines. Then palifermin, keratinocyte growth factor, prevent the mucositis followed by chemotherapy. जो mucositis होता है chemotherapy के बाद में, so palifermin is the drug. Palifermin is drug known as a keratinocyte growth regulator. तो जब mucositis adverse effect होता है, मतलब जो mucus layer है वो remove हो जाएगा chemotherapy की वजह से. So in that palifermin drug is used. Pilocarpine is used as a cholinergic agonist, radiation-induced xerostomia. Eyes में problem आता है तो. Pamidronate and zoledronate, they are the bisphosphate used in the hypercalcemia caused by malignancy. Epoetin alpha and darbepoetin alpha, so they are erythropoietin. They are used in the chemotherapy caused anemia. Filgrastim and pegfilgrastim. So granulocyte colony stimulating factor होता है and they are useful in the febrile neutropenia prophylaxis. मतलब एंटीकैंसर ड्रग के बाद में जो न्यूट्रोपेनिया होता है, so उसको प्रिवेंट करने के लिए फिल्ग्रास्टिन. Then sergramosin is a colony stimulating factor for monocytes and granulocytes, so it is useful in the again same condition neutropenia. Oprelvecin is the interleukin 11 agonist, so again useful in the thrombocytopenia caused by anticancer drug. So ondansetron क्या है? 5-HT3 receptor antagonist. It is useful to control the vomiting and nausea caused by anticancer drug. Granisetron, polonosetron both. Then aprepitant is a natural killer cell antagonist useful in the cisplatin induced vomiting. So these are the few drugs which are used as a concurrent therapy or drugs used to prevent the toxicity of anti-cancer drugs. You can order this magic bullet for GPAT Niper DI Pharmacist. Read 2-3 times before exam and qualify 100%. You can contact me on this number. You can see we have very much promising results from past few years. Thousands of students they are placed in the Niper. You can also join our GPAT Niper 2024-25 online batch. Here you will have live lectures, recorded lectures, study material, hard copy will be given at your doorstep. Online test will be there. All lectures will be subject wise, chapter wise. Everything is there in a 8,000 valid for 2 years. If you get all in the rank below 20 in the GPAT exam, your fees will be written in the form.
Hello students, order the magic bullet for GPAT Niper Drug Inspector, read twice and qualify 100.